Hey guys, Dr. Dan here. Sorry about that delay, been moving into a new house, but today we're coming at you. We're gonna look at shin splints, especially today, not looking at the front of the shin, anterior tib, but we're gonna look at the medial shin splints or posterior tibialis. This muscle is really important because it gets tight, especially when you're doing things right now like running, sprinting, jogging. If you haven't been doing these activities and then you notice a big ramp up in activity level, then this muscle can get really tight and cause some irritation on the inside part of your shin. Today we're going to go over some assessments and some treatments that you could do at home, and then taking this with you while you're maybe flying, while you're going to different places. If you're sitting down a whole lot at home, gives you some opportunity to work on it. So first things first, go ahead and take those shoes off so we can get an accurate measurement of what we're dealing with. All right, so for assessments, we're going to come over to a wall. We have the kneeling ankle dorsiflexion test, and then we have a standing test. Both of these are going to look at what the calf complex is from the back side with the knee bent and then with the knee straight. All right, so our first test here, this is scalable to everybody. Use your own fist because it's proportional to your body. You're going to go a fist away from the wall. You're going to put that, line that toe up with that fist. You're going to make sure your heel stays in contact with the floor at all times, and then you're going to drive that knee to the wall. Clearing this test is making sure that your heel can stay grounded the whole time and you're not over-pronating, or the ankle is not dumping to the inside part of the floor here. All right, we don't want to see this. We don't want to see flat arches. I want to see a nice open arch, a big dome of the foot. This is really important. We'll talk about it a little bit later. So our first test, fist, foot away from the wall. Can you get that knee over that foot towards the wall? And we're lining that knee up towards the second and third toe. All right, guys? Not towards the big toe, maybe a little bit towards the pinky when we start to mobilize it, but a little bit more towards the middle of the foot. Our second test, this is gonna also look at hip extension. Hip extension is really important because if I don't have this extra range of motion in the hip, then I have to make up for it at the ankle. And that's where I'm gonna start to get maybe some impingement or some pain on the front or the back side. So second part of this test, you're gonna take your opposite foot, line it up to the wall, then take the foot that you're testing, line it up to that heel. From here, make sure you're using a door space so I can lean forward into it. I'm looking to touch the front of this hip bone to the wall. Can I do that, yes or no, while keeping my back heel on the ground, while keeping my back knee nice and straight? What we're looking at here is usually this measurement across various different heights and different people's body proportions. This is about 25, 30, maybe 20 degrees. So somewhere in that 20, 25 degree window of can my hip get extension and can my ankle get enough dorsiflexion, meaning can my foot come up this way towards my shin enough to clear for activities like running, jumping, sprinting. All right, so we need those range of motion just for the joints to make sure I can get in the right proper positions to absorb and adapt to stress. So guys, reviewing knee to wall, that one's bent, and then hip to wall, that one's straight. That one is with that foot away from the wall, testing this one out, making sure I squeeze the glutes as I lean forward. A couple things we're gonna see here. So let's come over to the whiteboard. Let's talk about why this posterior tib is probably getting strained and stretched. What we have in the foot is a tripod. So a tripod has 3 points. For the foot, I have the big toe, the pinky toe, and the heel. So this is gonna make up what we have as the foot. All right, so I have to keep balance between all these 3 points when I jump, sprint, land, run, all of those fun things. Now what happens is, we saw earlier, if I don't have enough dorsiflexion, meaning if my knee can't get over my foot, what's gonna happen is my ankle is gonna start to spill towards the floor. Not sure if you guys can see that, but this bone right here, that's gonna overpronate or spill out onto the floor. You'll see this a lot with people who are crossfitting and they don't have adequate range of motion in their hips. So what they're gonna happen is when they squat, knees dive in, and to clear space for my ankle joint, the ankles are gonna spill this way when I squat and they stand up. So maybe it's not always a glute problem. Maybe you gotta look at the ankles. If the ankles are stiff, I'm gonna spill in, and that's gonna lead to other things downstream. When this happens, the ankle joint that sits probably about 2/3 the way back in the foot, this joint here is gonna move medially, and that's gonna strain the muscle or that tendon that's on the inside part of the arch of my foot. So my heel here, that posterior tib muscle, is gonna run right around this ankle joint, and that's gonna get overstretched or strained when I do things like sprint, when I run, when I jump. Some of those jumping, landing, plyometric activities, that's gonna cause an overstrain of that muscle. So fixes. Guys, your assessment becomes that test, which then becomes your treatment, all right? If I can't get my knee to the wall, this becomes a self-mobilization. Keep that heel down. I can use my hands. I can add a little bit of tibial motion, which means I'm just taking my hands around my shin, rotating it, pushing towards the wall. I can do this from a standing position. Say I'm stiff, I couldn't get there. What I'm looking for is a stretch in the backside of more of the calf. I don't want to really overstrain what's already overstretched, that posterior tib. I want to make sure my calf is doing more of the stretching. Second one here is that runner stretch. I can turn this into a mobilization as well. So I'm driving my hip to the wall and back. If I want to take things from Gary Gray, I'm going to move in 3 planes of motion. Guys, I'm going to move forward, backwards, so flexion, extension. Maybe a little bit of transverse point work. Maybe into some rotation, spinning, twisting. All right, as well as some medial lateral rotation. So working on some IR, ER, left and right, abduction, adduction, and then flexion, extension. All trying to loosen up those fibers of the calf. A couple other things. If you have a foam roll, take this foam roll, pop down underneath that calf, start down maybe in the heel cords, so that Achilles, maybe some of the peroneals, maybe some of that posterior tib. Take the other foot, cross it over. You're gonna roll back and forth, just getting some tension into those fibers, because that foot's just gonna get pretty tender if you're doing things like running, jumping, cutting. Especially with this COVID time, if you have just been sitting at home watching Netflix, watching some awesome TV shows, and then you're like, hey, I really want to sign up for a half marathon or a 5K, and I haven't been doing anything. And you just start doing activity, you're gonna start blowing up these tissues. It's not gonna feel really good. So make sure you're spending some time, giving some love and some care to your calf here, all right? So rule of thumb here, you wanna breathe through a lot of these activities. If you're doing these motions and you're not able to breathe, your body's not able to relax, all right? So as well as I can move medial lateral and rotate my leg, I also want to be able to move my foot while it has tension. So from my side, putting tension down, crossing over, adding some more overpressure, and I'm going to plantar flex and dorsiflex, making sure I'm moving through that range of motion. A little bit of pin and stretch, right? Moving on down. You want to find where you're most restricted. Sometimes the restriction is going to happen up above the knee, or right below the knee, excuse me. So work medial, a little bit of rolling here, and then doing a little plantar flexion, dorsiflexion, maybe a little inversion, eversion. We'll take a look at this as well on a box. And then I can roll into that peroneal, that lateral head of the gastroc. So what I'm looking at on my small little white boy calves, on the outside here, this is where I want to roll on the outside, and on the inside, I want to roll through this portion. If I don't have access to this, I've got a wine bottle or a hydro flask. Those work really well. The second thing, and I think is really important, you could do this while you're hanging out for your flight. You could do this while you're sitting at home, just resting, whatever. Take your foot, cross it over. We're gonna do a little bit of pin and stretch along that posterior tib. So it's gonna run from about this region around the inside of your ankle. And it's gonna attach to the medial part of your shin bone here. All right, so find that meaty aspect of your shin, all right? And then you're gonna apply whether baseball, lacrosse ball, maybe even softball or golf ball here, all right? So I'm gonna roll through this area, just give myself a little massage. what I'm gonna notice is it starts to get real junky around the ankle, because that's where all that motion should be coming from. And if I've been dealing with this issue for a while, this may have turned into a tendonitis or a tendinosis, and there's a little bit of difference between those two, but what we want to work on is just the muscle belly first. All right, so the muscle belly is going to start behind the ankle joint and then come about 2/3 the way up the shin. All right, so from here I can do some plantar flexion, dorsiflexion. That's going to get the gastrocsoleus complex. Posterior tib, for that I'm going to work into inversion and eversion. Those are the motions that we're gonna notice when the ankle is limited. I'm gonna spill out into that supination, or excuse me, that overpronation, where I'm driving down. All right, I don't want this to happen. This is not good athleticism. This is injuries just waiting to happen. All right, so to avoid that, guys, take that ankle, you're gonna work up, you're gonna work down, working up, working down. Next piece of this, since we've loosened up the tissues, let's work on creating more stability through the joint. First one here, putting a band around the toes. I'm just gonna create some tension through the anterior shin. Make sure I can feel that muscle burning. I can start doing some holds. This is all open chain stuff, so it's not gonna be as good as if my foot is on the ground. That's what I really wanna train. So, foot on the ground, a couple things we want to take a look at. Can I keep this arch intact as I balance, right? 3 points of contact that we talked about with the whiteboard, right? Big toe, pinky toe, and heel. And do I still have an arch there? I don't want to hear you've got an extra bone in your foot, which is why you've got no arch. Everyone's got an arch, you just have a weak one, and you need to train it, because it's your body, and no one's going to come along and do bicep curls for you. You've got to do the bicep curls for your own foot. So again, turning this into a simple exercise where I can just balance here, or maybe I do toe reaches, right? I think the Grey Cook guys and the FMS guys were onto something when they started looking at the wide balance test and saying, how far does my ankle have range of motion if I have stability in all of my joints? Guys, we're not just looking at the ankle when I do these balancing exercises. We're looking at the hip, I'm looking at the knee, I'm looking at the torso. What's happening at all of those joints to contribute what's happening with load dispersion at the foot. Am I spilling into overpronation? Am I straining that posterior tib? If so, I need to retrain the rest of the system. A lot of times when athletes are running and when they're just hitting the ground and taking off, they end up spilling out into this externally rotated position. The ankle's gonna dive forward. I'm gonna see a really funky knee position, and that's gonna open up more windows of opportunity for injury and not for performance. So make sure you're doing your knee to wall clearing test, your hip to wall clearing test, and then treating what you find. Guys, if you have any questions, shoot me a direct message. I'll be happy to get back to you with more videos, more content. Again, Dr. Dan here, signing off.